Advances in total hip and knee replacement technologies have heretofore been largely driven by corporate marketing hype, each seeming advancement accompanied by a cost increase often out in front of peer-reviewed reports documenting their efficacy or not. As this slide suggests, healthcare expenditure in the United States as a percentage of gross domestic product approaches 17%, higher than any other reporting country, and rising at an unsustainable rate. It is interesting by comparison that spending in the United Kingdom and other countries is markedly less. As a contemporary technology example, consider the growing use of ceramic femoral heads in primary total hip arthroplasty. The question to consider is, can an upcharge of $350 for a ceramic femoral head be justified? The answer to this question lies in an appreciation of whether the introduction of ceramic technology modifies the potential for readmission and revision arthroplasty in the intermediate to long term. According to data presented in the 2022 Australian National Joint Replacement Registry, the 4 leading causes of primary hip arthroplasty failure requiring revision are infection, dislocation, instability, fracture, and loosening, which constitute 87.5% of the reasons for revision. Appreciating these 4 failure modes individually, it is well established that decreasing the articular-bearing couple wear rates decreases the potential for osteolytic response, leading to loosening and potentiating fracture. This is dramatically appreciated where ceramic is employed, as derived from simulators. This graph depicts an almost 50-year timeline dating from the days of the Charnley low-friction arthroplasty to today's ceramic endpoint. Further, the utility of ceramics enables large heads to be employed to avoid the potential for dislocation, not different from a cobalt chrome equivalent, but again assisting the reduction of wear debris generation. Historically, alumina and subsequently zirconia ceramic hip components were introduced as low-friction arthroplasty bearing alternatives as far back as the 1970s, with their first clinical use attributed to Professors Bottine, Mittelmeier, and Sedell, and gained FDA approval in 1982. However, these ceramic couples were not without their challenges. The early drawbacks to their use have been attributed to poor implant design, acetabular component loosening, low-quality ceramic, resulting in debris generation and fracture, and significant alignment sensitivity, all of which dampened enthusiasm, ultimately leading to their abandonment in the United States. Their contemporary popularity lies in appreciation of evolutionary improvements that have been made both to the materials and their certification prior to in vivo use. These include minimization of impurities to reduce potential stress rises, reduction of grain boundaries to substantially improve material strength and fracture toughness, inclusion of zirconia, strontium, and chromium additives to improve strength and inhibit crack propagation, proof testing of all individual components to overcome the potential for early fracture. Despite these now claimed manufacturing improvements, the proof of the pudding lies in earlier clinical reports of mid to long-term outcome studies. Utilizing alumina on alumina bearings, the overall survival rate has exceeded 95%, with virtually no osteolysis, fracture, or squeaking. With the increasing use of hip replacement in younger, more active patient populations, there is a defined need for bearing solutions of longevity. Correspondingly, the reported sales of ceramic femoral heads in the United States has increased consecutively, and in 2021 was reported to have exceeded 70%. This is indicative of surgeon confidence in their employ. Beyond their reported clinical longevity as bearing surfaces, the realization that the majority of contemporary femoral stems are modular suggests that metal head stem taper interactions resulting in fretting corrosion can be a contributing cause of revision. The increasing use of ceramic heads poses the following question. Can ceramic heads reduce the prospect of head taper fretting corrosion? A series of retrieval observations presented by Kurtz suggests that this may indeed be the case, which is further supplemented by a most recent publication from this group. The use of ceramic femoral heads not only reduces the burden of polyethylene debris, but also cobalt and chromium, as well as their ions, all of which have been associated with adverse local tissue reactions, leading to revision total hip arthroplasty. Lastly, could bearing surface choice influence periprosthetic joint infection? A study on a total of more than 10,500 primary total hip arthroplasty procedures with a minimum of 2-year follow-up produced the following incidence of confirmed periprosthetic joint infection. These results suggest that the employ of a ceramic bearing surface may play a role in decreasing the potential for infection following primary total hip arthroplasty. After review of this available data for ceramic bearings, the potential for reduction of healthcare dollars spent through advancing technologies would clearly suggest that it is better to pay me now than to pay orders of magnitude later, if in fact a revision total hip arthroplasty can be avoided. At the end of the day, arguments have been advanced suggesting that the use of ceramic femoral heads contributes to the long-term durability of primary total hip arthroplasty procedures, reducing the need for revision. Although there is a cost increase associated with their employ in primary hip reconstruction, avoiding the prospect of significant revision costs reduces the financial burden on the healthcare system. Thank you.